So, in this clinical snippet, we are going to discuss some very important localizing signs in a case of paraplegia. So, he is a young boy of around 23-24 years. He presented with gradually progressive weakness in the both lower limbs with log-like sensations, leading ultimately to complete paraplegia, urinary incontinence, and what we are going to see in this snippet is how to localize, and in this case there are certain interesting signs that can localize the segmental lesion in a case of paraplegia. I am starting with abdominal reflex, superficial abdominal reflex, which is a superficial reflex. The root value is from T7 to T12, T7 to T12. So what is the importance of abdominal reflex in a case of paraplegia? So this is the upper quadrant of the abdomen. You can see it is fantastically contracting. So upper abdomen is contracting. Lower abdomen is not contracting. Lower abdomen is not contracting. Lateral abdomen, mild contraction present here, not present. Again repeating, watch carefully. No contraction. Secondly, I am going for another interesting clinical sign which is known as Beaver sign. Before that, we can know that if we divide the abdominal reflex from T7 to T12, upper abdomen is T7 to T9, umbilicus is D10, and below D10 to D12 it is the lower segment. And what we saw here was presence of upper abdominal muscle contraction, absence of lower abdominals. Okay, now we go for another test which is known as Beaver's test, for which I will ask the patient to get up the upper torso. Forcefully he will try to pull himself up from the upper torso. करके दिखाओ, फिर से सीधा हो जा, लेट जा, फिर करो. You can see, फिर से लेट जा. The umbilicus is going up when he is getting up, trying to get up. फिर से करो बेटा. हाँ, लेट जाओ. Again I am going to show you. Here is the mark of umbilicus. See what will happen now. ऊपर उठो. It's going up. फिर से लेट. फिर से करो. See, umbilicus has gone up. This is known as Beaver sign. When the patient is asked to get up, the upper abdominal muscles are contracting because there is the paralysis of the lower abdominal muscles. The umbilicus is getting pulled up. This is a localizing sign along with the abdominal reflex. The segmental sign is the segmental level here will be D10. The segmental level will be D10 in a case of paraplegia. To confirm other signs, as we know the cardinal rules of cord lesion, there is at the level of lesion there will be lower motor neuron signs, and below the level of lesion there are upper motor neuron signs. So what happened here? All the superficial reflexes are lost is the mantra of upper motor neuron paralysis. So abdominals being a superficial reflex, upper abdominals were spared, lower abdominals were absent because below the lesion superficial reflex should be lost. So abdominal reflex is lost here, and the deep tendon reflexes are exaggerated. Let us see what happens to the deep tendon reflexes in this case of paraplegia. हाथ जो लेना है सेक्शन में पीछे से. हाँ देख ढीला ढीला छोड़ दे, ढीला छोड़ दे, बस ढीला छोड़ दे. So exaggerated or very brisk knee jerk, ढीला छोड़ दे आराम से. Ankle jerk, exaggerated ankle jerk, and what you are seeing, this sudden flexion, dorsiflexion of the ankle You can see also along with this, intermittently there is dorsiflexion of the ankle and flexion of the knee and flexion of the hip. That is intermittently he is doing it. See, these are flexor spasms. Little bit of stimulus is causing flexor spasms. These are automatic involuntary flexor spasm and hallmark of open motor neuron disease. Now here also exaggerated. This ankle I will not touch because he had an accident when he was a child, and there is a foot drop. So I need not go for the ankle jerk here. But in this limb you can see another important. ढीला छोड़ दो. You can see sustained clonus, ankle clonus. You can see sustained ankle clonus. Here I can't test for that because there is the already traumatic foot drop here due to some accident. Now last but not the least, you can see interestingly the involuntary spasms, that is flexor spasms. Now the last sign, that is, we can go for the Babinski sign. See, there is plantar extensor, extensor plantar, plantar extensor. So Babinski positive. To summarize, in this case of paraplegia, with upper abdominals paired, lower abdominals absent, positive Beaver's test, knee jerk exaggerated, ankle jerk exaggerated with clonus, plantar extensor with flexor spasm. So the segmental level of lesion will be D10 and the vertebral level will be D7.